I'll be talking to you about an introduction to antimicrobial consumption. So what we aim today is to go through what is antimicrobial use, antimicrobial and antimicrobial consumption, why is it useful, and what can we do when we collect that type of data, and what the benefits and limitations of these when we collect data relating to antimicrobial use, and what techniques can we use to collect that data. What is antimicrobial use data? This can be split into two groups. So we can split this into antimicrobial sales and antimicrobial use. Antimicrobial terminology by the WHO refers to antibiotics, antivirals, and antifungals, for example, which are also products that are used to treat infectious diseases in humans, animals, and plants. But today we're very much solely talking in the context of antibiotics only when we're referring to antimicrobial. So commonly this can either be sales data at the point of production or use data at the point of prescription and use by the sectors. This is a diagram of antimicrobial consumption in general. You might hear the term antimicrobial consumption as well, and this incorporates kind of sales, either stratification of sales and use data also. Stratification sales data is an estimation of the antimicrobial sales per animal species or production sector, and is based on an approximate allocation of a proportion of the total sales of products to each species, and that's commonly reported by either the or estimated by the pharmaceutical company or sponsor. Why do we want this data, and why is it useful to have antimicrobial use data? So antimicrobial use data can be of value to multiple different levels of stakeholders. So for the producer or farmer, an understanding of their use compared to similar farms can enable them to benchmark and lower their use of antibiotics if they see how they use them, and help inform that farmer vet discussion regarding what antibiotics are being used on farm. On a national level, government and policymakers can use the information that's collected to understand how antibiotics are used in the livestock sectors, and it can be used by national industry stakeholders such as the National Pig Association to show their reduced usage after initiatives they may put to the industry. And nationally, a better understanding of antimicrobial use can provide a framework for targeted research and development work, and be correlated with antimicrobial resistance data to develop an integrated analysis of the use and resistance of bacteria that's isolated with humans, animals, and the environment. And then internationally, having that data can help with trade negotiations and an international reputation regarding what happens in the sectors. This is a kind of a diagram of the flow through of a product being created and being to the point of when it's used in an animal. So there are different points of this that we can collect data. So the first one being sales data at the beginning. That can be collected from the pharmaceutical company or the wholesaler. And then we have usage data on farm, and that is from the producer and animal at the end. And then we have imports data can be used in replacement of sales data, and we have prescription data that can be from either the vet practice, the feed mill pharmacy, or the producer. into the benefits and disadvantages of these types of data. So sales and import data is obtained either by the pharmaceutical company, either from the pharmaceutical company or the wholesalers. This type of data is fairly easy to obtain and is less resource intensive because you have less groups to obtain the data from. However, from this data, it can be difficult to determine the sales to which species it's sold or which sector it's being used in, and therefore it may not be a true representative of the use of antibiotics in the country. Another point is that the product may be sold by the manufacturer 1 year to the farmer, say, and it may not be used or sold, may not be used until the next year, and therefore the product isn't being used at the current time, and therefore we can get a reduced accuracy of the data by overestimating or underestimating use. And then it's also important to note that import data can be used instead of pharmaceutical data and represent a very similar point of data collection. So the next group is prescription data. So prescription data can be obtained from veterinary practices, the producer as the receiver of prescriptions, or the feed mill if they've medicated feeds have been used. This data can have a benefit that it can be used to can be correlated to disease issues, and that can provide an understanding of the use of antibiotics for sectors. And this can assist in animal health initiatives to improve welfare or reduce disease prevalence within the sectors and therefore reduce the antibiotic use. However, this type of data can be a bit labor intensive because you're collecting data from multiple different data sources, and those sources being veterinary practices, they might have different software, different systems, different ways of recording, and therefore it's slightly unharmonized data, and that can slow the process. So it can be difficult to collate the data altogether easily. Another source, kind of the final stage of that flow of pharmaceutical product, is the farm level data, and that relates to data of products being administered to animals. The main benefit of this data is that we can give an accurate species data regarding species usage, and it can be analyzed as with the prescription data to review disease trends within species for surveillance purposes or for disease initiatives. However, as there's multiple farmers, multiple different groups, comparing this to your original wholesaler data, and the farmers may store them in different formats, such as a physical written format or on-farm level software, and therefore, as with the prescription data, it can be hard to harmonize and collate it all together. As well, different sectors have different numbers of farmers. So in the UK, we have lots of farmers who produce cattle and sheep, but and that can make it difficult to collect the data. And also farms may be multi-species, so we're collecting multiple different species data from a single farm. So splitting which product is being used for which animal can be a bit difficult. And also this data can be potentially unreliable if the farmer hasn't written down the medication when given, and therefore that data may be missed from our recording. Ways that we can collect that sales data, so at the beginning of the diagram, is potentially from vet practices or wholesalers, or that import data that we collect. And then for the use data, we can look at points like health records, treatment books, delivery notes, invoices, and pharmacy records and vet records as well. And then I've obviously got here point prevalence survey. So we'll just go into this on the next slide. So point prevalence surveys are common in the human hospital setting for hospital care associated infections, which is HCAIs, and for monitoring antimicrobial use. These surveys are completed by collecting data over a couple of days, so potentially a single day for each ward or unit, with the whole hospital collecting data no longer than in a 2 to 3 week time period. And this type of data collection enables monitoring of antimicrobial prescription and consumption behavior on site, and that can be used to inform therapy decisions or to assess public health consequences of the antimicrobial misuse and value the impact of resistant containment interventions. And this type of survey can be very beneficial when there's a lack of comprehensive national data for a common health for these types of infections, and appropriateness of antimicrobial use, and it can to inform infection prevention control and antimicrobial stewardship initiatives. But obviously this is in potentially just a one hospital setting, and it may not be a true representative for the national use, because we're only surveying one point in time. So the WHO methodology for this type of survey suggests to aim to collect baseline information on the use of antibiotics in hospitals, and expect it to repeat it every few years. They can be used where anywhere where antimicrobials are used, and they are or where unbiased antimicrobial resistant rates are not yet known. Here is an article at the bottom here. It was where a point prevalence survey was implemented in an equine hospital to monitor their antimicrobial use, and the conclusion that they found was that it enabled them to find what they were using, and that enabled targets for actions regarding how they were using highest priority critically important antibiotics, their prophylactic use of medications, and the lack of stop and review data that they did not have before. The factors we need to consider when we're collecting all these types of data, so farm level, pharmaceutical level data and prescription level data, is that for farm level, producers may not be interested in submitting the data to potentially a national project, and they may be concerned how their data is going to be handled, and especially if potentially if it's by government, and if they can be concerned if it's going to have a negative impact on them. And it's important, I guess, that the producers can still have access to the data once they've submitted it, to enable them to benchmark, as I said, as a benefit, and improve on their usage. There can also be currently multiple data collection systems in place, and if they're trying to collect that all together, you can have a lack of standardized data collection, which can make it difficult to get that all together because of the different types of data collection system. And the data needs to be stored safely, maintained and validated, and that can add cost to collecting data. In addition, there needs to be clear roles and responsibilities for those who are all involved in collecting this data, and especially when it comes to creating a data collection program. And kind of leading on from that, when creating a program, a big part of it is how is that collecting of data going to be funded? Is it going to be funded by government or private industries? And once that data collection system is in place, how is that funding going to be maintained for that project?